Hey everyone, and welcome back to Breaking Down Nursing. Today we're going to talk about nursing school survival tips. And I will have to apologize in advance, as you probably hear my dog chewing on his little bone behind me. So let's get started. Tip number 1, study for the NCLEX from day 1. A lot of times we want to study just to pass the next test, but remember, every class that we have in nursing school builds on each other. So the things you learn in fundamentals are fair game for when you get into Med-Surg 1 or Med-Surg 2, and you can't really lose anything. So strong students study to think like a nurse. So take the material and start critically thinking. You want to shift your mindset. Always ask, what's the priority? And always think ABCs, Maslow, safety, and always least invasive first. And when reading content, ask, what would they test from this? Tip number 2, master patho before memorizing your interventions. At the end of the day, if you understand why something happens, you don't need to memorize as much. Instead of things like CHF causes edema, think low cardiac output because of pump failure, increases RAS activation, which then increases sodium and water retention, which causes fluid overload, which then leads to edema. If you understand how all these mechanisms play together, you really can deductive reason through any question they may throw at you. So the trick is for every disease, know what the cause is, what goes wrong in the body. Is it a organ failure? Is it a system failure? Is it a hormone malfunction? Some 3 key signs and symptoms, 3 of the most dangerous complications, and 3 priority nursing interventions. Tip number 3, stop passive studying. Rereading notes is comfortable, but if you're just rereading them constantly, they can be useless. Instead, use things like flashcards. These help with active recall. But don't buy flashcards. My suggestion is always to make your own and write them out. There's a motor memory connection that happens when you write out your own flashcards. Your brain doesn't know the difference between letter S on a keyboard and letter K on the keyboard, but it does when you actually physically write out the letters. And so writing will help to ingrain that muscle memory. And also, you'll put these in your pocket and carry them everywhere you go. You'll get back these things we call micro minutes throughout the day. Flip through them constantly throughout the day, anytime you have a break. Break between studying, waiting for class to start, waiting for work to start. So any of these times you could be flipping through and actively studying all day instead of trying to find a way to block out an hour of time. Memorization is all about repetition. Things that we actively have to memorize, flashcards are your best friend. On average, we need to see something about 13 times before memorize it, unless you have a photogenic memory, which I don't, so I'd be super jealous. Do practice questions. So write your own, or your friends and study groups can create practice questions together. Quiz each other. And last but not least, whiteboards. Whiteboards are wonderful for active recall and memory. However, they're just not easy to carry around all day. And that's where your flashcards come in to carry with you. Tip number 4, protect your energy. Burnout ruins performance. And this isn't even just for when you're a nurse, which it could do the same in the workplace, but also at school. Some successful habits to decrease burnout: sleep before exams. Memory consolidation matters and requires sleep for you to actually take that information and bury it into long-term memory. Another trick of the trade, instead of sitting down and trying to study for 8-hour blocks, do it in increments. After about 45 minutes, our brain starts to go into scroll mode, and some people it goes even faster. So study in focused 45 to 60 minute blocks. After each 45 or 60 minute block, get up, take a 10 to 15 minute break, stretch, move around, get some water, and then jump back in. And this way you can also change. If you have multiple tests coming up, you can switch between Med-Surg 1 information and patho or pharmacology. And that way you have a break and your mind can reset in between the breaks that you have. Don't compare grades. I know it's very hard not to want to sit after you take a test and compare grades. And when you start comparing grades, you start to feel bad about yourself instead of driving yourself to understand and learn the material for your future patients. Build reliable study partners. I highly recommend small groups, not groups of 6 or more. And this is because the more people in the group, the more opinions that happen, the less likely we are to work instead of making it as a social group. Remember, consistency beats intensity. Tip number 5, prioritization is always better than perfection. You do not need to know everything. It's impossible to know everything in medicine. They're coming up with new testing, new medication, and new information every day. You need to know what kills first, who to see first, what to report immediately, and what is expected versus unexpected. When you're overwhelmed with any question, ask, is this airway? Is this a breathing problem? Is this circulation problem? Is this acute or chronic? And is this patient stable or unstable? To help you narrow down and refocus your mind. If 2 answers look right, pick the one that involves assessment before action, is least invasive, or addresses safety first. And keep in mind that ABCs are always king, and they're always in order. Nursing school is demanding, but every concept you learn and every challenge you overcome is preparing you to care for real patients. Stay focused, stay consistent, and remember why you started. With the right mindset and study strategies, Success in nursing school is absolutely within your reach. And when in doubt, reach out for help. As always, take care and have a wonderful day. See you next time.